Trachoma. Trachoma is an infectious disease caused by the bacteria known as Chlamydia trachomatis. Trachoma is one of the leading causes of chronic inflammation of the conjunctiva. That is, the conjunctiva, look at the conjunctiva, is the membrane that covers the white part of the eye and the inner surface of the eyelid. This eyelid is being covered by this thin layer, and that is known as conjunctiva. And if you look at it, look at the fly that causes trachoma. And this eye is already undergoing the second stage of this trachoma eye infection. Look at the flies that transmit this disease. And this is opacity of the eye. In this person, the opacity has occurred and likely blindness will set in. Trachoma is an ocular surface infection caused by Chlamydia trachomatis, and it is one of the leading causes of preventable blindness worldwide. So when we say it's an ocular surface infection, we mean that it affects the conjunctiva, the inner part of the eyelid, and the corneal surface. Now let's talk about the conjunctiva. It's good we have a good understanding of the conjunctiva. The conjunctiva lines the back of the eyelid, like I said earlier, and that part of the conjunctiva that lines the back of the eyelid is known as palpebral or tarsal conjunctiva. It crosses then in between the lid and the globe, where the eyelid, if you check this picture now, where the eyelid, you see this place now, look at, this is the palpebral or tarsal conjunctiva, like it is that conjunctiva that lines the inside part of the eyelid. Now, inside of this eyelid, you will see where the globe and the eyelid meets. So this conjunctiva found here is the one we are talking about. And that conjunctiva is known as funicle conjunctiva. Then this conjunctiva folds back again to spread all over the sclera. That is, the white part of the eye entirely is covered by the conjunctiva, and this is known as bulbar conjunctiva. The conjunctiva contributes to the tear film that protects the eye from foreign objects and infection. You know that the tear that comes out from the tear gland has a lot of functions it does on the eye. One, it protects the eye from infection, it lubricates the eye, it prevents the eye from desiccation, drying up. So conjunctiva contributes to this function. The sclera is the thick white sphere of dense connective tissue that encloses the eye and maintains its shape. You recall that in the previous sections, we discussed about this part of the eye, and I told you that the conjunctiva, the sclera provides attachment for muscles, eye muscles, extraocular muscles. And the sclera also contributes in light refraction through the cornea. Now, anteriorly, the sclera fuses with the cornea at the limbus, and posteriorly, it blends with the meninges, where the optic nerves leaves the globe. The thickness of the sclera varies from 0.83 millimeter anteriorly to 1 millimeter posteriorly. It is about 0.43 millimeter at the equator and 0.3 millimeter under the muscles. It is the thinnest point of the sclera, that is around 0.3 under the muscle. There's another part you need to know known as the episclera. Episclera is a thin vascular membrane. It contains vessels between the conjunctiva and the sclera. So that is where you found the episclera. Now let's go back to the infection known as trachoma. Trachoma is an infectious disease caused by the bacteria Chlamydia trachomatis. It is one of the leading bacterial infectious cause of blindness worldwide. But however, it is preventable. This disease leads to chronic inflammation of the conjunctiva and can lead to blindness. It is being transmitted through flies and also from fingers of infected persons and in the family, especially in endemic area. So in endemic area, children are vulnerable and usually face the highest challenge. Trachoma can lead to blindness. It is a chronic keratoconjunctivitis caused by Chlamydia trachomatis, and it's the most common cause of avoidable blindness. And it does very well in environments that is dry and dirty. Now let's look at the pathology and clinical features of this eye problem or eye infection. The onset is usually insidious, that it starts as if it will not be serious. The infection may be asymptomatic, that the person may not really present with any sign, and it could last for years. It may be latent over a long period and may recruit descent. That is, it may reoccur after a time. The conjunctiva of the upper lid is first affected. Remember, the conjunctiva has different parts. The one that lines the inner part of the eyelid, the one that lies at the margin between the eyelid and the sclera, the one that lies over the sclera. But the one that is most commonly affected first is the one that lines the upper eyelid. So the conjunctiva of the upper eyelid is first affected with vascularization and cellular infiltration. So inflammation contributes to this disease condition. Let's proceed. Early symptoms of this condition include conjunctival irritation. The patient begins to feel irritation, like something is in the eyes, and blephorous spasm. That is a kind of spasm that occurs at the eyelid. It undergoes several spasms of the eyelid, and the patient will be noticing them. The early follicles are the characteristic. So, but when this starts to happen, the patient might confuse it with ordinary conjunctivitis. But however, as this follicle continues, it can lead to scar formation, which will now cause the inversion of the lids, known as entropion, so that the lashes now rub against the corneal surface, known as trichiasis. The cornea becomes vascularized, that blood vessels begin to grow on the cornea, and now the cornea will undergo what is known as opacity, whereby light rays can no longer penetrate. The unfortunate part of it is that vision, this problem may not be detected very early until vision fails. So this is a brief summary of what happens from conjunctival irritation to spasm on the eyelid, then formation of follicles due to inflammation, then to scar formation in the upper eyelid, which leads to inversion of the upper eyelid, exposing the cornea to irritation by the lashes, known as trichiasis. As that lashes rub against the cornea, it leads to vascularization of the cornea and opacity. Once the cornea undergoes opacity, then blindness might set in. Now let's look at the stages of this trachoma. First stage is early signs of trachoma. That first stage is known as trachomatous inflammation follicular. This is well known by the presence of 5 or more follicles. And what is these follicles? Follicles are small raised areas that make the person feel that something is under the eyelid in the upper tarsal conjunctiva. Look at this, is known as the tarsal conjunctiva. You know, because this is the inner part of the eyelid that usually close the eye. So look at the trachomatous inflammation follicle. These follicles here you are seeing will begin to create irritation. The person will begin to feel like gritting sensation on the eyes. And what actually leads to this is due to inflammation caused by lymphocytes migrating to the conjunctival tissue. And this is as a result of the activation of T lymphocytes and B lymphocytes, which proliferate due to immune response. Immune response to chlamydia trachomatis infection of the eye. So that is what, let's look at it, it's becoming vascularized and follicles are developing. And these follicles contains immune cells. The next stage is the moderate to severe trachomatous inflammation, known as trachomatous inflammation intense. This particular stage is well characterized by intense conjunctival injection and papillary hypertrophy. Papillary what? Hypertrophy. If you look at here now, look at it has moved from the other stage, this stage, to becoming highly intense. As such, there is a shift from follicle formation, you can no longer see the follicle now, to a more diffuse irritation with plasma cells and macrophages being found here. Also, some inflammatory cytokinins such as tumor necrosis factor alpha and interleukin-1 and interleukin-6 leads to recruitment of more immune cells, which continues to worsen the swelling. It keeps on what? Swelling. Look at here. The swelling is not that much during the follicular stage. It's not that much. But at this intense inflammation stage, the swelling has become much. Look at the swelling here. It's now becoming much due to the involvement of other immune response to come and kill the bacteria. And this leads to scar formation due to that chronic what? Inflammation. That leads us to the next stage, known as trachomatous scarring. This stage is characterized by fibrosis of the upper tarsal conjunctiva. Look at it, it has become fibrosed. At this point, it's becoming irreversible. Look at how it has turned the eyelid that's supposed to close the eye upward. And here is the scar formations on the eye. And look at the sclera, the cornea, and the iris. But look at half of the eye is already covered by the inward part of the eyelid due to this scar formation. As such, this eye can no longer close very well. So what led to this chronic inflammation process? And once fibroblast forms, there will be collagen deposition. which result to permanent scar formation here, because this is forming a permanent structure. You remember that before fibroblasts and others occur, it must result from inflammation. So this is the third most intense part of this trachoma infection. And at this point, extracellular matrix is disrupted, and there's imbalance between matrix proteins and other inhibitors, which contribute to fibrosis. So one thing you must know about that is scar formation and fibrosis. Now, this fibrous formation and scar formation leads to anatomical changes. This is not how the eyelid usually is. The eyelid is supposed to cover with the lashes matching against the lower lashes, but now it is upward, which predispose the cornea to more irritation. It's not exposing the cornea. Ideally, the eyelid covers the eye with the conjunctiva contributing to tear formation, making it to be moist. But now it's no longer there because it has gotten a different shape. That leads us to so one thing you must know about third stage is the fibrosis and scarring that occurs, which leads to entropion. This is known as entropion. Okay, this is known as entropion. It's an eye condition whereby that affects the lid. And lid assumes this type of structural shape. That's one thing you must know about third stage. Now, the fourth stage. The first stage is known as trachomatous tracheasis. Now, the third stage leads to the first stage. The first stage is the main point. The entropion begins in the third stage. Then when it gets to first stage, known as trachomatous tracheasis, entropion is full. It's not a full-blown entropion. What is entropion? Entropion is when the eyelid turns inward, which causes lashes of the eyes to rub against the cornea. So the stage 4 is the full-blown entropion. The stage 3 is entropion. But the full-blown entropion is at stage 4, whereby there is inward turning of the eyelid and the lashes rubbing against the cornea. So this severe scarring causes retraction. Recall, I said in the third stage that there's fibrosis and scar formation. It is this scar formation that causes retraction and abnormal positioning of the eyelid, which leads to corneal aberration. So it is the third stage that leads to the first stage, it's the full-blown entropion. And when there's entropion, the eyelid have assumed this abnormal position, which now allows the lashes to be rubbing against the sclera, the cornea. The continuous irritation of the cornea by these lashes leads to what is known as keratitis. That is, inflammation of the cornea. The cornea undergoes another stage of what? Inflammation, which worsens and can damage the cornea, which can lead to loss of vision. Look at here now. This eye is already undergoing keratitis. So as this inflammatory process continues, opacification can occur due to repeated injury and healing response. So as it continues to injure, as the lashes continue to injure the cornea will try to repair and heal, leading to formation of more scar, and at a point, the cornea can no longer allow light entry, and that is known as opacification or corneal opacity. The fifth stage, the full-blown corneal opacity, which leads to blindness. Here, the eye has undergone full blindness. Look at this stage that leads to opacity. It is coming. But here, the eye has fully undergone a full corneal opacity, which can lead to blindness due to scar formation. At this point, light can no longer enter these eyes. And look at the lashes, because most of them are, because one of the preventive ways, once it's at that third stage, is to remove the eyelashes. So if you look at here, this person already removed the eyelashes to reduce the eyelashes rubbing against the cornea. That is what happened here. But look at full eye opacity, the corneal opacity. Light cannot enter. Now, what are the likely differentials? What other condition can present as trachoma? One is viral conjunctivitis. But however, you differentiate it because viral conjunctivitis is acute and self-limited, because viral infections are usually self-limited, and this viral conjunctivitis is acute, whereas trachoma is insidious and chronic. So that's how you would say, no, this is not this condition. This may likely not be trachoma, or this may likely be viral conjunctivitis. Another classical differentiating factor is watery discharge that occurs in viral conjunctivitis. But in trachoma, it does not occur. Another condition that can present like this is bacterial conjunctivitis. All of them affect the conjunctiva. And this bacterial conjunctivitis is caused by species such as Streptococcus pneumonia and likes. But however, the key differentiating factor is that in bacterial conjunctivitis, it is acute and there is pus formation. There's pus formation, and the discharge is more of pus. Another condition that can present this way is corneal abrasion. That is when there is injury to the cornea. But however, during the history taking, you can find out that the patient might tell you that it's a result of trauma, something wound me, or one thing or the other. So you now know that this is not trachoma, this is likely corneal abrasion. Now let's look at the prevention as healthcare workers. One of the ways of preventing this condition is through personal and family hygiene, especially in regions where this condition is highly endemic. So proper washing of the hands, because it can be transmitted from flies at the first contact. As the person keeps on rubbing the eye, trying to scratch or whatever, or trying to remove the eyelid, when it gets to trichiasis due to entropion, or when the follicles is now is giving irritation on the cornea, the person will be touching it. The discharge from that can, from the chlamydia trachomatis, can be on the finger, and if it gets to another person's eye, it can get the person infected. Or if a fly perches on the person's eye and goes to another person, it can transmit it to the person. As such, personal hygiene is important. As person keeps on washing your hands often and on. Then proper care of the eyes of the newborn and young children is very essential. And the drug of choice is azithromycin. The drug of choice is azithromycin antibiotics. Then the next way of preventing this condition is through contact tracing and examination. When you continue to trace contacts and try to examine them, and use the prevention strategies such as the administration of azithromycin antibiotics, mass azithromycin campaign administration, it can help prevent this condition. Then facial cleanliness and environmental improvements are part of the process of preventing this condition. But however, WHO, which is the leading organization in the prevention of this condition, has put forth what is known as safe strategy. Safe strategy. Safe strategy is used for control of trachoma in endemic region, which is surgery. In advanced cases where the cornea have undergone opacity, the only way to restore it is through surgery, whereby the cornea is replaced with another because already undergone scarring. Another strategy in that safe is mass administration with antibiotics, known as azithromycin. The next is facial cleanliness. Facial cleanliness with water and soap. And lastly, environmental improvement, especially among those who rear cow. Mostly in area where cow is being reared, these flies go to cow, get this, and can fly and perch on individuals. And when this happens, they can transmit this disease condition to people or persons. So that is why environmental improvement is important. Keep cows where they do not have direct access with humans, so that it wouldn't be transmitted to another person. This condition is also common in Africa and Asia. And the name of the fly is Musca subins. Musca subins. So that is the name of the fly. So in this section, we'll be able to look at how trachoma occurs, the pathophysiological process from the first stage known as early sign of trachoma or trachomatous inflammation follicular, where there is follicle formation. Then due to inflammatory response by activated T lymphocytes and B lymphocytes, which proliferate and contribute to immune response against chlamydia trachomatis infection. Then it now proceeds to second stage, which is moderate to severe, known as trachomatous inflammation intense, whereby there is conjunctival injection, where it becomes more expanded, it gets more inflamed and injected, and there's pupillary hypertrophy due to increased shift of white blood cells, macrophages moving to that eyelid in order to go and fight. Then it leads to the third stage known as trachomatous scarring. And this trachomatous scarring leads to formation of fibroblasts and collagen deposition. And when there's fibroblasts and collagen deposition, it will now restructure that organ to assume a different shape. And this causes anatomical change of the eyelid. Then it proceeds to the first stage. The third stage leads to the process of entropion because it begins in third stage. Then it leads to the first stage known as trachomatous tracheasis, when the eyelid have assumed a wrong position that enables the eyelash to be touching the cornea directly or rubbing the cornea directly, known as entropion. And this leads to corneal irritation and opacity of the cornea, known as keratitis. And once there is keratitis, it leads to the fifth stage, full corneal opacity. The corneal opacity begins from the fourth stage, and once there is corneal opacity, it can lead to blindness. And once opacity is enough to cover up the cornea, the patient cannot see further. We also look at differentials and the preventive ways of this disease condition, known as the safe strategy, surgery, antibiotics, facial cleanliness, and environmental improvements. Thank you very much.